Can cholesterol be too low? Understanding the risks and causes. It is possible for cholesterol to be too low, although this is far less common than high cholesterol. Most cholesterol-related concerns focus on elevated low-density lipoprotein, LDL, often referred to as bad cholesterol. However, some individuals may experience very low LDL cholesterol, and in rare cases, this could lead to health complications. Some health experts suggest that low LDL cholesterol may be linked to anxiety, nervousness, or sleep disturbances, while others argue that lower LDL levels are consistently beneficial. At the same time, having high-density lipoprotein, HDL cholesterol, the so-called good cholesterol, that is too low can also be problematic for long-term health. This article explores the essential functions of cholesterol, the difference between HDL and LDL, and what can happen if cholesterol levels drop too low. What is cholesterol? Cholesterol is a waxy, fat-like substance produced by the liver and also found in certain foods. Despite its reputation, cholesterol is vital for the body. It contributes to the structure of cell membranes, supports brain health, aids in the production of hormones such as estrogen, progesterone, and testosterone, and plays an important role in digestion and nutrient metabolism. The challenge arises when diets high in saturated fats and sugars lead to excess cholesterol, increasing the risk of cardiovascular disease. On the other hand, when cholesterol, particularly LDL or HDL, becomes too low, it may interfere with essential biological processes. Can cholesterol be too low? Yes, cholesterol can be too low. While uncommon, excessively low LDL or HDL levels may pose risks. LDL delivers cholesterol to the body cells, where it supports hormone production, vitamin synthesis, and other vital functions. If LDL cholesterol drops too low, these processes may be compromised. Low HDL cholesterol is also a concern. HDL helps clear cholesterol from the bloodstream, protecting against arterial buildup. Insufficient HDL can increase the risk of cardiovascular disease and other metabolic complications. The difference between HDL and LDL. LDL cholesterol, bad cholesterol, can accumulate in the arteries, raising the risk of heart disease and stroke. HDL cholesterol, good cholesterol, helps remove excess cholesterol from the bloodstream, lowering cardiovascular risk. Both are necessary in balance. Extremely low levels of either can be harmful. What causes low cholesterol? Cholesterol levels can be influenced by diet, genetics, lifestyle, and medical conditions. Causes of low HDL cholesterol. Several factors may contribute to low HDL cholesterol, including high carbohydrate diets, which can reduce HDL while raising LDL and triglycerides by 30 to 40%. Elevated triglycerides. End-stage kidney disease. High-dose beta blockers or thiazide diuretics. Obesity and metabolic syndrome. Sedentary lifestyle. Severe liver disease. Smoking. Rare genetic disorders such as Tangier disease. Type 2 diabetes. Malnutrition. Low HDL cholesterol often occurs alongside other metabolic problems, increasing the risk of heart attack, stroke, and diabetes. Be proactive. How to maintain healthy cholesterol levels. You can raise your good cholesterol, HDL, and maintain overall balance by following a heart-healthy diet rich in whole grains, lean protein, fruits, and vegetables. Engaging in regular cardiovascular exercise. Quitting smoking. These same lifestyle choices, combined with maintaining a healthy weight, especially around the midsection, can also help lower bad cholesterol, LDL. Low LDL cholesterol. In most cases, lifestyle changes that lower LDL cholesterol are beneficial. However, when LDL levels drop significantly without intentional efforts, the condition is known as hypobetalipoproteinemia. This may signal an underlying health problem such as thyroid disease, blood cancers, infections such as hepatitis C, malnutrition or poor nutrition, chronic inflammation, genetic disorders, cholesterol-lowering medications, wasting disorders. These situations are rare. More commonly, people lower their cholesterol through prescribed medications, especially when LDL levels are 190 milligrams per deciliter or higher. Some concerns have been raised that cholesterol-lowering drugs may reduce LDL levels excessively. However, large clinical trials have shown that even when LDL cholesterol dropped as low as 25 milligrams per deciliter, participants reported no significant negative side effects. What are the risks of low cholesterol? From a cardiovascular perspective, total cholesterol cannot be too low. But when HDL or LDL levels drop below healthy ranges, potential risks arise. Risks of low HDL. HDL levels below 40 milligrams per deciliter are considered too low. With less HDL in circulation, the body has a reduced ability to clear excess cholesterol from the bloodstream. This increases the risk of atherosclerosis, hardening of the arteries, heart attack, stroke. In addition, HDL has antioxidant properties, protecting arteries from damage caused by fatty acids. Low HDL levels, a condition known as hypoalpha-lipoproteinemia, may accelerate plaque formation and vascular damage. Risks of low LDL. While low LDL cholesterol is often viewed as beneficial, very low levels may not always be ideal. For example, during pregnancy, extremely low LDL levels may disrupt hormone balance and contribute to premature birth. Some studies suggest a link between very low cholesterol and mood disorders such as anxiety, depression, and even suicidal thoughts. Research has also found possible associations between very low cholesterol and higher risks of certain cancers. It is important to note that more studies are needed to determine whether these risks are directly caused by low cholesterol or whether they stem from other factors such as medications used to manage high cholesterol. Can vitamins help? In some cases, vitamin supplementation may help support cholesterol balance. High-dose vitamin E 100 to 300 mg/kg per day and vitamin A 10,000 to 25,000 IU per day have been studied for their potential role in normalizing LDL levels. However, supplementation should always be discussed with a healthcare provider to ensure safety. What are the symptoms of low cholesterol? Research into the health effects of low LDL cholesterol is ongoing. If low LDL contributes to conditions such as depression or anxiety, symptoms may include persistent feelings of hopelessness or despair, changes in sleeping or eating habits, confusion and agitation, difficulty making decisions. Normal cholesterol levels. HDL and LDL levels are measured through a simple blood test. For adults in the United States, the following ranges, measured in milligrams per deciliter, mg/dl, are considered standard. HDL cholesterol, good cholesterol. 60 or higher equals protective for heart health. Less than 40 equals too low. Over 80 equals may be linked to increased all-cause mortality. LDL cholesterol, bad cholesterol. Below 100 equals optimal. 100 to 129 equals near optimal. 130 to 159 equals borderline high. 160 and above equals high. For individuals with a history of heart attack, stroke, or coronary artery disease, the recommended LDL level is less than 70. The American Heart Association and American College of Cardiology generally advise keeping LDL at 100 milligrams per deciliter or lower, as people in this range tend to have lower rates of cardiovascular disease and stroke. Cholesterol tests also measure triglycerides, blood fats, and total cholesterol, which is the combined level of LDL, HDL, and triglycerides. How to keep cholesterol within a healthy range. There are no medications designed specifically to raise HDL cholesterol, aside from hormone replacement therapy for postmenopausal individuals. However, lifestyle changes can help normalize cholesterol levels. Avoid saturated and trans fats. Eat a diet rich in fruits, vegetables, whole grains, and nuts. Exercise regularly. Limit red meat, processed foods, and refined sugar. Achieve and maintain a healthy weight. Stop smoking. Take prescribed statins if recommended by your healthcare provider. Aim for a total cholesterol level between 150 and 200 milligrams per deciliter, and monitor your levels regularly with your doctor. Current dietary recommendations. You do not need to eliminate all dietary cholesterol. Updated guidelines removed strict cholesterol limits because dietary cholesterol has less impact on blood cholesterol than once believed. Instead, the focus is on the types of fats consumed. Good fats. Unsaturated, monounsaturated, and polyunsaturated fats lower heart disease risk. These are found in oils, olive, canola, sunflower, soy, corn, fatty fish, nuts, and seeds. Trans fats, bad fats, even in small amounts, these increase cardiovascular risk. Although largely removed from packaged foods, they may still be present in fried foods. Saturated fats. Less harmful than trans fats but still linked to cardiovascular disease when consumed in excess. Sources include red meat, fast food, and pizza. The dietary guidelines for Americans recommend limiting saturated fat to no more than 10% of daily calories. The American Heart Association sets a stricter cap at 7%. Some foods, like eggs and shellfish, are high in cholesterol but low in saturated fat, making them better dietary choices. Summary: understanding cholesterol is essential for long-term health. HDL levels of 60 or higher are considered protective, while anything under 40 is too low. LDL levels under 100 are optimal, though ongoing debate remains about whether LDL can ever be too low. Current research increasingly supports the idea that lower LDL is generally better for heart health. For more expert, science-backed guidance on cholesterol and overall wellness, subscribe to HeInfo, your all-in-one destination for trusted health information.